Heat and cold syndromes are two principles used to differentiate the nature of diseases. Heat and cold syndromes reflect the states of yin and yang in the body. Jing Shui held that cold and heat are mutations of yin and yang. Symbols of heat and cold syndrome, heat syndrome, and we have the cold syndrome. Cold syndrome is attributable to the invasion of pathogenic cold factor or depletion of yang or excess of yin. Symptoms: number 1, cold form, cold limbs, sober with white complexion, curled up, recumbent posture, desire for warmth, yang qi is insufficient or impaired by exogenous pathogenic factors and fail to warm the organism. Number 2, tasteless in the mouth, excessive yin, cold, do not harm to body fluid, so there is no thirst. Number 3, phlegm, saliva, and nasal discharge, long micturition with clear urine, thin or watery stools, yang being insufficient and incapable of steaming the fluid. Number 4, tense pulse, so cold is congealing. Number 5, slow pulse, yang being insufficient, not enough strength to mobilize the circulation of qi and blood. Sa heat syndrome naman denotes to symptom complex that is attributed to invasion of pathogenic heat or excess of yang or depletion of yin or hyperactivity of the organism. Sa symptoms, number 1, there is aversion to heat and preference for cold. Exuberance of yang produce excessive heat. Number 2, there is thirst, desire for cold drinks, short micturition with dark-colored urine, consumption of body fluid by heat. Number 3, there is yellow, thick phlegm, nasal discharge, fluid decocted by yang heat. Number 4, flushed face, flaming of fire. Number 5, restless, fire impaired the heart. Number 6, there is hemorrhage, fire burned the collateral veins. Number 7, there is a dry stool, heat in the intestine. Number 8, there is dry tongue, yin fluid is impaired. Number 9, red tongue with yellow coat in rapid pulse, indication of heat syndrome. Sa identification of cold and heat syndrome, sa cold syndrome, there is aversion to cold limbs, preference for warm. While sa heat syndrome, there is fever, aversion to heat, preference for cold. Sa cold syndrome, tasteless, no thirst. While sa heat syndrome, dry mouth, thirst, desire for cold fluid. Sa cold syndrome, somber, white complexion. Sa heat syndrome, there is a flush complexion, congested eyes. Cold syndrome, quiet, while the heat syndrome, restlessness. There's long micturition with clear urine sa cold, and sa heat, short micturition with dark-colored urine. Sa cold, there is thin and watery stool, while sa heat, there is dry stool. There is pale tongue with white moist coating sa cold syndrome, while sa heat, red tongue with yellow dry coat. There is slow pulse or tense pulse sa cold, while sa heat, there is a rapid pulse. Principles of treatment: cold syndrome, warm to expel cold, while sa heat syndrome, clear away heat and reduce fire. Main points for distinguishing between cold and heat syndromes. We have the manifestation, aversion to cold or heat. Sa cold syndrome, there is aversion to cold, preference for heat. While sa heat syndrome, there is aversion to heat, preference for heat. While sa thirst, ang cold syndrome, there is absence of thirst. Sa heat syndrome, thirst with preference for cold drinks. Sa complexion, Cold, lightly pale, while sa heat, flushed. Sa forelimbs, cold syndrome, cold. Sa heat, warm. Sa stools, there is a loose stool sa cold. May constipation sa heat. Sa urine, there is clear and profuse sa cold. Yellow and scanty sa heat. Sa tongue, pale tongue, white and moist coating. While sa heat, there is a red tongue and yellow coating.